So hello friends, welcome to the channel once again. Today is a special day. I have with me one of the MBBS students from AIIMS. He is Dr. Fazil Mohsin and he is a fourth year, a final year MBBS student. So welcome to the channel, Dr. Fazil.
Thank you and welcome to viewers also.
Okay, so the purpose of bringing an MBBS student to the channel is the fact that he is from the batch 2018. So he is supposed to appear in the exam called Next 2023, which is we believe will happen in 2023. And I wanted to clear doubts in your minds, those of you in my viewers who are preparing for the exam, because so much of confusion and so much of fear created by the coaching industry in your mind that this exam will change the medical education in India and so forth. So let's hear from the students, the best MBBS students from the country. How are they preparing for it? So Dr. Fazil, you have recently completed your third year and you will be entering your final year and you will have to appear in the next afterwards. So what is your plan as of now? How are you planning to do this?
First of all, I'd like to tell viewers that we have a different pattern of examination at AIIMS compared to other colleges. We have no professional exams in our third year. So many of colleges in India hold third professional exams where they give subjects like PSM, ENT, and other such subjects. So we don't have that exams. What we have is final prof, like first prof in first year, second prof in 1.5 year, and then finally we have final prof. That's the 4.5 year of MBBS. So this exam we will be having in January. So what's my plan for next is, first of all, I haven't changed much approach. बहुत ज़्यादा ऐसी change नहीं की, but हाँ, there is people are saying that next will be more clinically oriented exams. And अभी के जो recent INICETs and other entrance exams हैं, there is an increasing trend in clinically oriented questions, and that's a good thing because basically at the end what matters, especially for the clinical subjects, if you enter into if you want to be a clinician, so clinical subjects are important. Apart from that, the paraclinical subjects are also important. Preclinical subjects are also important, like physiology and biochemistry. Some people might have interest in entering into biochemistry or physiology, so it depends on interest. यहाँ पर what we have been following for past years, that initially we have focused on our books, textbooks, and in AIIMS there is a trend that initially students don't join any coaching. So first and second year, no coaching. Some students join some coaching in third year, and in fourth and fifth year, basically people start preparing for PG in their final year. And if I say कि और ज़्यादा इसको extra वो करें, refine करें, तो basically we start our PG preparation from internship. But the thing is कि next में ये scenario change हो गया, and next is a kind of final prof plus final professional exam plus your exit exam, entrance exam. So this is a difference. तो उसके लिए we have started coaching from third year. तो online coachings वगैरह हमने third year से start कर ली. But हाँ, एक जो full fledged होता है कि next के लिए जो war level पर तैयारी शुरू होती है. So some of my batchmate have started it, but I will start from January only.
Okay, so basically you have more than a year, like 1.5 years for the actual exam, and it will be as a final prof plus that same score will be used for your PG seat selection as well, right? So as you rightly pointed out, the exam will be more of clinical based exam. So what is the general trend? When do you people, the students of AIIMS, start reading Harrison?
Generally, it depends from individual to individual. One of my batchmate, he started from second year only. Okay, so he started reading Harrison from second year. Some of us don't read Harrison. What we do is that we have up to date. There is a software application that's known as up to date. Might be using that because we have a free access at AIIMS, so we use up to date and we read the recent updates and all. So some people say that that's better than Harrison because it is being updated every now and then. So some of us go like this: they read coaching material and then clinically they read up to date. Some of us read Harrison, but generally जैसे Davidson mostly पढ़ते हैं. कुछ डेविडसन पढ़ते हैं, कुछ नोट्स पढ़ते हैं, कुछ हैरिसन से पढ़ते हैं.
So what I actually get from you is that there's no one particular gold standard strategy. Every student will follow a particular pattern. Maybe Harrison, somebody may follow some coaching notes plus some other material. Okay, and that's true for every college. Now, the point is that most of the students are like you. They will have 1 year, few more months for the exam. So what books are you planning to study for the next 1 year? So because you'll be preparing medicine, surgery, obstetrics, pediatrics, what all books are you planning to study?
So, okay. So from like if I talk about books, so books are more important as our senior have guided us. Books are more important for your professional exams, and PG notes are sufficient and more than enough for PG entrance exam. If you cover PG notes and do PG coaching, जो अभी Marrow and Prep Ladder and then e-Group वगैरह है, तो सब में से अलग-अलग मिला के किसी का कुछ पढ़ा, किसी का कुछ पढ़ा. So in that way, that suffice for PG. But for our professional exam, we have to focus on this thing. We have to focus on for our professional exam. We have to focus on books. So for pediatrics, we do OP-GAI. OP-GAI is from the AIIMS professor only. VK Paul and other people are there. OP-GAI हम peds के लिए पढ़ते हैं, and फिर आपकी सर्जरी वगैरह है, तो उसके लिए जनरली बेली एंड लव के कुछ टॉपिक्स पढ़ने होते हैं और कुछ टॉपिक्स हम नोट से करते हैं, कुछ टॉपिक्स हम मतलब इट्स एक्चुअली नॉट कि वी फॉलो अ पर्टिकुलर बुक. Our senior generally tell us, okay, this topic you should read from this book. This is better explained in this book, and this topic you should go for this book. This is better explained in that book. So इस तरह से we don't really follow. For some subject, for example, pediatrics तो OP-GAI के अलावा कुछ नहीं follow करते, right?
What about obstetrics? What about obstetrics gynecology?
Obstetrics में obstetrics में जैसे कि what I was following, वो मैं follow कर रहा था इनके lectures. What is her name? Marrow में पढ़ाती है ma'am. I'm forgetting her name.
Dr. Sakshi Arora.
Dr. Sakshi Arora. And then उसके बाद से ये पढ़ते हैं, क्या कहते हैं, उनके notes और plus जो हमारे teacher पढ़ाते हैं, जो clinicals में पढ़ाते हैं वहाँ के notes, तो ये दो combine करके पढ़ते हैं, तो ये हो जाता है. Generally JB सिंह की जो book आती है, हमारे ही professor है वो, तो उनकी book भी हम लोग follow करते हैं.
Okay, so basically the material is everywhere the same. चाहे student AIIMS का हो,
शेषाद्री भी फॉलो करते हैं, मतलब शेषाद्री भी ऑब्स्टाइनिंग के लिए फॉलो करते हैं.
So basically the books, exactly. So there are two things to remember from this conversation. One, you have the same material. See, whatever authors he said, everybody reads the same books. Second, everyone is advised to consult his senior at his college, who is going to guide him that which topic is given the best in which particular textbook. So we'll have to refer to a few textbooks, jahan se, like, you will cover almost everything in your subject, and same time you can use your coaching notes. I myself am not a fan of coaching industry, but okay, if coaching helps you to maintain a strict timetable and helps you to give tests, so that's in a way that's a great bonus. Now, Dr. Fazil, can you tell me any particular mistake that commonly people make in third year MBBS or during these MBBS days that would affect their preparation, for next or other PG entrance exams?
It's very important. One of the most important thing that you're not going to get anywhere else after completing your MBBS is that different exposure to different departments. So maybe you go and end up being an obstetrician, or you may end up being a pediatrician. But if you miss some postings like ENT postings, dermatology postings, anesthesia postings, and other postings in your MBBS, you're not going to get opportunity to cover for these postings. But तो आप कभी भी लेंगे, but these postings are very precious. So I guess you should not these postings. I didn't miss personally, but many of students miss these opportunities. So this is not good. And
in fact, if your exam is going to be a clinically oriented exam, it is better that you attend all the clinical postings and learn the clinical pearls bedside or in your OPD when your teacher teaches you. So that's the best place to remember them for a lifetime. So that is an important thing you pointed out. Another thing,
what I have personally observed, when I go and see a particular case, and then again I come back and read that case in book, so that thing, retention for that thing in my mind is longer, and I understand that topic much better than a topic which I have never seen. So this is a nice thing, and at AIIMS we get so much opportunity to see these kind of cases.
Yes. And another thing that I know from you, that you've been like reading the USMLE stuff a lot. And in fact, the point I want to make is that these books, the ones you'll be reading for USMLE, help a lot even in the NEET PG or AIIMS entrance or INICT or the upcoming next exam. So these books are not exclusive to USMLE. Many of your seniors, even I have read the USMLE books, and I have done good in AIIMS entrance, PG entrances, and subsequently on other exams as well. So can you tell more of which books are you reading on that section?
I have talked about MLE, but right now I have not started preparing for MLE. Okay, let me tell about myself, what I have been doing. So right now, these days I have been following my, trying to explore my academic domains. So I have been enrolled in, I can say 5 or 6 research projects in UZ only. I have completed about 3, 4 of them, and 2 and 3 are about to be completed. So I am very much into doing researches and all. So those are the things that I have been doing these days. So these things helping ML. Apart from these things, the books that I have done for MLE is Pathoma, and that helped me a lot in my professional exam also. So that's a nice thing because very concise and very nice conceptual overview. And after that, you have to read Robinson pathology. That's must to do things.
And one more last thing that I want to point out to the viewers and the students is that, see, the exam names may change. They might change NEET to next to some other name, but the books will not change. The subject material will not change. Even the difference of prof exams and the entrance exams, it doesn't matter if your concepts are strong, if you're read from the standard books and you know the things. So it doesn't matter whether you have to write a note on a question or you have to answer an MCQ from a question. So with that, I would thank you, Dr. Fazil, for clearing some of the doubts that my viewers would have had for this exam. And in fact, he himself was saying to me the day before that he's himself not very clear how the exam is going to be. So we all are in the same state. So everyone knows little about the exam pattern, but the point is read the standard books, prepare well, study hard, and whatever the exam pattern, everybody is in the same boat. So I wish luck to all my viewers. I wish luck to obviously Dr. Fazil as well. He will do good in the exam, I know. So thank you for this video. Thank you, Fazil.
Thank you. I'm also thankful for you.
Okay, bye.
Bye.